Hi, my name's Emily. I am 28 years old and I am a criminal solicitor living in North Wales. I am making this video this morning to talk to you about my experience with Operation Recovery during this COVID-19 pandemic and hoping to reach out with some tips for anyone else going through anything similar at the moment. So, if I start at the beginning, for those of you that don't know me, at the beginning of March 2020, I required surgery to remove stage 4 pelvic, ovarian, and bowel endometriosis, and also a bowel resection. So, the first operation was 8 hours long and thought initially to be a success. You may be able to see where I'm going with this, but unfortunately in the 3 weeks post operation I required a further 3 surgeries and I had 11 emergency blood transfusions, including about 48 hours in the intensive care unit. However, it's not all doom and gloom. I'm pleased to say I've been home from hospital for 2 weeks now, just over 2 weeks. I am still mid recovery, but I just wanted to talk to you about my experience so far. So I spent a total of 28 days in hospital, and during this COVID-19 pandemic, unfortunately, during that time, I wasn't allowed any visitors. So for me, the mental aspect of the recovery has been just as challenging as the physical aspect. Because for anyone that's been in hospital, I'm sure you can appreciate that 1 hour in hospital feels like a day. So 28 days without seeing any of my loved ones face to face was really difficult. But there are certain things that got me through and helped me get to this stage now. So I'll talk about those next. My first tip would be to keep a diary. Now, I'm not a girly girl. I've never kept a diary before. It doesn't have to be anything fancy. It can literally just be a notebook, and you can just write the date on the top of the page. But I found it really helpful every day to write down something that I had achieved that day. The reason being that weeks can pass, and recovery is a slow process, so you will sometimes reach hurdles and you may feel, I'm ever going to get better. I've been like this for ages. I've just feel poorly for so long. Will this ever improve? But if you have kept a diary and you've made a note of little things that you've been able to do throughout your journey, then you can look back and see how far you've come in 2 weeks, for example. You may write down one day, today I've been able to sit up. It doesn't have to be anything more than that. The next day you may write, today I've been able to put my socks on. And then 3 weeks later you may be writing, today I've been in the shower. But you may be having a particularly bad day that day, and you may think, oh, a shower, is that it? But actually, if you can just flick back and see that 2 weeks ago, sitting up for you was a massive achievement, then that can really help mentally to keep you going and spur you on. The second thing I would say is try and remember that nothing lasts forever. A lot of times we hear that in a negative sense when people say, oh, well, nothing will last forever. But actually, if you apply it to this situation, um, it's a positive because this pandemic will not last forever. You will soon be able to have your family come round to see you. Um, pain, pain is temporary. Pain will not last forever. You will feel better. So um, it is really important to try and remember that this won't be forever. You will have a positive mental attitude. I know, trust me, I know, sometimes that is easier said than done, and I would be a hypocrite if I sat here and told you that I haven't had a cry and I haven't had a bad day. Of course, I have, but it is really, really important that you don't allow yourself to be the victim for too long. Because I can hand on heart tell you that the days that I have let myself be a victim and I have had a cry, I have felt a lot worse than the days that I wake up and I say, this is temporary, nothing lasts forever. Soon this lockdown will be over, soon this pain will go, and it really does help. Another really important thing that's helped me, I'd say, is staying in contact. Of course, stay in contact with friends, family. You've got FaceTime, you've got Zoom, WhatsApp, etc. But actually also with things like follow-up appointments, I haven't been able to go to the hospital for a follow-up this week as I should have, but I do have a video chat with the consultant booked for tomorrow, so don't be afraid to ask, don't be afraid to keep in touch with your doctors. Just because you can't necessarily go to the hospital or the surgery, they will still be there to help you if you have any questions. Don't feel like you're alone at all, because you won't be. They will be there, and technology is amazing. If you'd have told me that I'd be having video chats with consultants in January, I wouldn't have believed you. But it is there, and it is there to help us. So use what we have, utilise technology as best as you can to keep in contact with everyone you can. Similarly, obviously I'm off work at the moment. It's really important, I think, to keep in touch with my employer so that I don't feel too ostracised when it comes to actually going back to work. And again, I've been able to do that via video chat, etc. Crucially, I would say be kind to yourself. It's strange, isn't it, that the negatives always seem to shout a lot louder than the positives, but try your best to just be kind to yourself, put yourself first. You have to be a little bit selfish, you have to rest. It would be easy to listen to all the negatives during this time. Personally, my mind has shouted out to me, oh, you'll never have a baby, for example. It didn't shout the positives, typically. It didn't shout, you're alive, you're going to get better, you have an amazing family. So try and silence those negatives. Try and just be kind to yourself. Let yourself rest. let yourself recuperate, try and focus on the positives. One thing that's really helped me, especially during the COVID pandemic, on days I felt a little bit sorry for myself and just want to see my friends, and I could list for days all the bad experiences that I've had. But what I try and focus on is what positive can be taken out of this. What have I learned from this whole experience? Personally, what I've learned is how loved I am. I've had so much support and love from my family. I've learned that technology is amazing, and we'd be lost without it at the moment. And thirdly, I've learned that the NHS is incredible, absolutely incredible, and they have point blank saved my life. As I said at the beginning, I've had 11 blood transfusions, and the hypocrite that I am, I've never ever given blood. I've always thought of getting around to it, but I've never thought that I would need it. Previously, I've not had any health problems. But the reality of the situation is that 11 strangers across the country gave blood and saved my life, and they'll never know that they've saved my life, but they have. So another positive is that I'm going to encourage more people to give blood. I'm not able to give it yet due to the amount of transfusions that I've had, but I have managed to convince my sister's partner, my husband, my friends' husbands, all to register. So again, just try and focus on those positives. So finally, just to summarise my points in terms of my recovery experience, I would say number 1, make a diary. Number 2, remember that nothing lasts forever. Number 3, stay in contact with friends, family, but also the medical professionals. They are still there. Number 4, be kind to yourself, rest, and try and silence those negatives. And finally, number 5, focus on what you've learned from this experience, like how loved you are or how amazing our National Health Service is. So thank you for listening and good luck.